Hello everyone, welcome to our lecture. In this video, we will study medical imaging and the specificities. Medical imaging is performed in a specific context, and image data produced are various and need special attention for optimal usage. In this video, we will start by defining medical imaging, and then give an overview of imaging modalities and the specific context of their usage. We'll conclude by presenting some challenges related to medical image management. Imaging is the process of producing pictures of something. Medical imaging aims to produce pictures of the human internal body, organs, and structures. Medical images are used to diagnose pathologies, guide or plan surgical interventions, and more. Depending on the needs, we have different methods of medical image acquisition. In this first part of the presentation, we will review some medical imaging modalities. Let's start with ultrasounds. Ultrasounds are special sound waves used in medicine to examine and produce images of organs or other structures. Ultrasounds are used to evaluate organs, blood vessels, or fetal development. Radiography or X-rays. X-rays are a type of radiation that can go through many solid materials, allowing hidden objects to be photographed. In airport security, X-rays are used to inspect the interior of luggage for security threats before loading on the aircraft. In medicine, X-rays are mainly used to examine bones or to detect problems affecting some organs. Computed tomography, CT. CT scan is a medical test that involves using X-rays to create a three-dimensional image inside the body. They are mainly used to diagnose tumors and investigate internal bleeding, infection, or damage. They are used to assess bone fractures, check lung conditions, or identify foreign objects in the body. Magnetic resonance imaging, MRI. MRI use radio waves and a strong magnetic field produce pictures of the organs inside the human body. They provide detailed images of soft tissues, organs, and the nervous system without any radiation. MRI is more precise than CT scans, so it is used to analyze thin structures like brain vessels or retinal vessels. Positron emission tomography, PET. PET uses radioactive substances, also called radiotracers, in nuclear medicine to visualize and measure changes in the metabolic processes. For example, the radiotracer gallium-68 is used in neuroendocrine tumors. The radiotracer 18-fluorid-desoxyglucose is used in rheumatology to detect vasculitis or in neurology to detect Alzheimer. In this second part of the presentation, we will talk about medical image management. Medical image management involves the entire life cycle of a medical image. It goes from the acquisition to retrieval and retrieval, ensuring better accessibility, security, and quality. In the previous lecture, we presented some file formats suitable for our data. In this lecture, we'll talk about medical image data file formats. The major medical image file formats are Analyze, MILC, NIFTY, and DICOM. DICOM for digital imaging and communications in medicine. DICOM is a structured file format including patient information, the description of the medical procedure, and the parameters used during the image acquisition process. DICOM is also a network communication protocol and is used by almost all the medical scanner manufacturers. Privacy and security. The security and the privacy of companies dealing with medical images are critical because the data are sensitive and the healthcare industry is heavily regulated. Data anonymization by encryption and removing patient information while preserving diagnosis data integrity is fundamental before any processing or sharing. We will conclude this video by discussing some medical image processing requirements and limitations. First, processing. Medical images are mostly affected by noise during the acquisition process, so processing like noise reduction or contrast enhancement is quite often performed before any processing. Requirements. Medical images have high resolution, 2D, 3D, 4D, and large file sizes, so the needs for material resource can be important for optimal processing. Limitations. Every medical image application is strongly data dependent because of the variety and difference of imaging modalities. For example, the segmentation of the same organ from CT and PET images of the same patient will be very different while we are using the same segmentation approach. In this video, we have learned that medical image data comes from various acquisition modalities such as ultrasounds and CT. Medical image processing is crucial in modern medicine because it allows new and more medical diagnosis, pathologist treatments, and research. The healthcare industry is heavily regulated, so managing medical image data requires paying special attention to security and privacy.